Zimbabwe has confirmed its first 2 cases of MPOX, the Health Ministry said on Sunday, before reassuring the nation that everything is under control as structures have been put on high alert, including at ports of entry. The cases were reported in Harare and Mberengwa in the Midlands province, and the people are in isolation at home receiving the appropriate care. This makes Zimbabwe the 17th African country to report cases of the viral disease.
The World Health Organization in Zimbabwe says it is working with the Ministry of Health to enhance response readiness and preparedness to combat this viral infection. Health Minister Dr. Douglas Mombeshora said the first case was an 11-year-old boy with a known history of having traveled to South Africa in August, returning to Zimbabwe on September 10. He then developed symptoms on September 23 and is isolating at home and no longer infectious. 7 contacts have since been identified and are being monitored.
The second case is a 24-year-old male with a known history of having traveled to Tanzania on September 14 and returning home on September 21. He developed symptoms on September 29 and is isolating at home and no longer infectious too. Contact tracing and monitoring is underway.
Now, according to the World Health Organization, to prevent the spread of MPOX to others, people with MPOX should A. Isolate at home following guidance from their healthcare provider or in hospital if needed for the duration of the infectious period from onset of symptoms until lesions have healed and scabs fall off. B. Cover lesions and wear a well-fitted mask when in the presence of others. And C. Usage of condoms during sex, even up to 12 weeks after recovering, and avoiding skin-to-skin or mouth-to-skin contact.
All right, yeah, so MPOX is real, it is in Zimbabwe. The encouraging thing is both those incidences which have been identified by the Ministry of Health and no longer infectious, both those patients are currently in isolation, but it is not an excuse for us to be lax. And I think it's very encouraging to hear the authorities say that they're stepping up and putting up structures, especially at the ports of entry. Both those cases coming through from Tanzania and South Africa. But a reminder as well, in terms of those guidelines that we just shared from the World Health Organization in terms of how we can manage and, more importantly, prevent the further spread of MPOX.
Right. Stick to protocols and don't be afraid.
Yeah, and be informed. And
be informed, yeah. Do your research about it as well, and be aware and actually notice if you have a lesion, get it checked, even if it's just a mosquito bite. Yeah. Literally, but we don't want further spreading of the disease.
Konapo ipapo ba ZTN Prime, DSTV channel 294, the place to be.